Welcome. Today we're exploring the fascinating world of genetic testing for periodontal disease, a tool that may transform how we diagnose, treat, and prevent gum disease. Our question is, what if we could predict periodontal disease before it even starts? What is periodontal disease? Periodontal disease is a serious gum infection that affects nearly half of the adults worldwide. It begins with bacterial plaque, but it doesn't end there. What really determines disease severity is the body's immune response, which leads to gingivitis and periodontitis. Gingivitis is reversible and periodontitis is irreversible. A fun fact, up to 50% of an individual's risk for periodontal disease is linked to genetics. Studies have identified several genetic markers such as IL-1 and tumor necrosis factor alpha, which influences inflammation and tissue breakdown. Think of it this way, bacteria starts the fire, but genetics decide how strong the flames burn. This is why two patients with nearly identical oral hygiene habits can have a very different outcome. We now have a video to answer your question of what is genetic testing.
Genetic testing looks for changes in one or more genes that may cause a genetic condition. The results of this testing could explain personal and/or family medical history, as well as provide information on future health risks. In some cases, the results of genetic testing may change medical treatment, or there may be actions that you can take to lower health risks related to the condition. Genetic testing is not the right option for everyone, so it can be helpful to learn more about genetic testing as you decide whether it is right for you and whether now is the right time. There are different types of genetic tests available. The right test for you will depend on personal and family history, as well as any previous testing in the family. Your healthcare provider or a genetic counselor can help you decide which test is best. Genetic counselors are healthcare providers who specialize in helping patients to understand hereditary conditions. If you have not met with a genetic counselor, your healthcare provider can refer you to one. There are several possible results you can obtain from genetic testing. A positive result is a genetic change that can be associated with an increased risk for medical problems. A negative result means that no important changes were found to explain your family or medical history. Sometimes, the results are less clear, meaning a change was found, but we don't know what it means for you or your family. Once your results are available, your healthcare provider or genetic counselor will help you understand what these results mean for you and your family.
Okay, so now we're going to move on to how genetic testing actually works. So it's actually really easy. A patient will provide a saliva sample or a cheek swab, and then this is sent to the laboratory where more advanced molecular tests analyze variations in specific genes linked to periodontal disease and inflammation. One example you may have heard of is Predict. It's a commercially available test. It screens for variations in the IL-1 gene, which is a cytokine strongly associated with tissue destruction for periodontal disease. And then within a couple days, the results return to the dental office. These results don't tell us if the patient has the gum disease. It's more so if they're at risk or if they're more susceptible. This knowledge allows us to tailor treatment plans and recall intervals based on their specific risk.
The sponge tip should not come into contact with any surface other than the inside of the cheek at any point before, during, or after collection. Do not eat, drink, smoke, or chew gum for at least 30 minutes before collecting the sample. Open the package. Remove the collector without touching the sponge tip. Place the sponge on the left side of the mouth, on the inside of the cheek, in the space where the lower gums meet the cheek. Scrape along this area in a back and forth motion at least 10 times. Move the sponge to the upper portion of the left side of the mouth, in the space where the upper gums meet the cheek. Repeat the scraping motion in the upper part of the mouth at least 10 times. Move the sponge to the middle of the inside of the left cheek. Firmly scrape the inside of the left cheek at least 10 times. Hold the tube upright to prevent the liquid in the tube from spilling. Unscrew the blue cap from the collection tube without touching the sponge. Do not drink or swallow the liquid. Wash hands with water if the liquid comes in contact with your skin or eyes. Turn the cap upside down, insert the sponge into the tube, and close the cap tightly. Turn the capped tube over and shake vigorously 10 times. Using the second collector tube, repeat the same process on the right side of the mouth.
And now moving on to advantages versus disadvantages. So advantages, early detection, more personalized care planning and treatment plans. Some patients will be more motivated with their oral health care if they know they're at risk. And then disadvantages, the cost. Clients may feel uncomfortable sharing their DNA with the lab, limited value. Genetic testing is part of a much bigger trend in dentistry, precision medicine. Advances in molecular diagnostics now allow us to study not only genetic markers, but also the patient's microbiome, systemic conditions, and lifestyle factors. Artificial intelligence is increasingly being used to combine these data points into predictive models. This means that genetic testing isn't just about predicting gum disease, it's about creating a complete picture of each patient's oral and overall health. So, again, with the advantages and disadvantages, while genetic testing is powerful, it should always be used as a complement to, not a replace for, just regular and traditional diagnosis and patient assessment.
So where do we see genetic testing in dentistry today? Some practices are already using tests like Periodontal to guide periodontal maintenance schedules. A patient identified as high risk may be placed on a shorter recall interval. Genetic testing is also to be used in labs for scientists to use stem cells and help regrow damaged or missing teeth. It can also be a powerful motivational tool. When patients see their genetic results, they are more likely to comply with oral hygiene instructions, smoking cessation, and regular visits. It is also being studied as part of interdisciplinary healthcare, connecting oral health with conditions like cardiovascular disease, diabetes, and even Alzheimer's disease. As for the future may include chairside tests that deliver results in minutes, allowing clinicians to screen patients during a single visit. We may also see AI-driven genetic calculators, where genetic data is combined with microbiome analysis and health records to generate personalized risk scores. Over time, genetic testing could become as routine as probing deaths, seamlessly integrated into electronic health records and standard care protocols. The ultimate goal is to provide precision prevention for every patient.
Interesting information. Patients are more OHE motivated after knowing their own genetic predisposition. After seeing what they are at risk for and what areas of weakness there is in their genetics, they are more likely to want to prevent such risks from occurring. Did you know periodontal disease and tooth decay have been linked to a genetic component? Microbiome analysis. This tool is used when the genetic testing could be beneficial for dental health care providers in the future, as predicting such diseases and conditions. For example, periodontal disease, conditions linked to inflammation and gingivitis, becomes at hand and will help make efficient diagnosis for clients. The main question and answer. The question being, what if we could predict periodontal disease before it even starts? The answer, genetic testing can provide valuable insight as a risk indicator. This will help clients become more proactive with their oral health and overall health. In conclusion, genetic testing for periodontal disease is an exciting innovation that brings us closer to personalized preventative dentistry. It offers early detection, patient motivation, and a glimpse into the future of precision care. As dental professionals, we're not just cleaning teeth, we're helping shape the future for oral health, and genetic testing may soon become a routine part of that journey. Thank you so much for listening, and here's a list of our references.